Hey everyone, Chris here. I am wearing my ultra soft fuzzy hoodie today because I am recording from the living room and it's a little cold out here. I also have my kitty, so bear with me. I know this is also coming to y'all a little bit late. This weekend just kind of got away from me, and so I was catching up on work stuff, and yeah, hope y'all are doing well, especially after, getting that recorded session in. And I'm going to try to have week 14 out this week as well. So this is week 13. We're going to try to do week 14 soon. Then you have the week after that off. And then, yeah, then we've got 1 week after that. So we're coming to the end. I'm going to share my screen and yeah, let's do this. And second to get this into, uh, let's see, I'm gonna share, do slideshow. Cool. Whew. Welcome to week 13. So today we're going to be talking about resourcing, also known as case management. And this can be for individuals, for families, I mean, heck, even for, a group or a community. So today for your check-in, I wanted to give you a moment to make something with your hands. I know this might seem a little like vague and silly. Um, but like for example, if you know how to fold something with origami, go ahead and do that. If you like to bake something, go ahead and do that. If you like coloring or knitting, or anything like that, I stumbled across this video, which I've linked down here, where the title is Your Brain Changes When You Make Things. Um, and I think doing something while in therapy, like with another person or with a group, um, it tends to be easier for people to open up about hard stuff or just stuff in general when y'all are working on something, you know? This can be, like for example, I think I've mentioned before, I have a couple of kiddo clients who don't really like talking a lot, and that's totally fine. So one of them, kind of colors the whole time, and I've started drawing stuff as well. I've been teaching myself how to do embroidery for a bit. Um, I think there is a lot of emphasis put on any kind of hobbies that we might have. We need to become experts or proficient enough in them to have like a side hustle. Like we don't have hobbies anymore where it's just whatever we're curious about or whatever we just want to spend our time doing or whatever we enjoy. And that's kind of sad because, you know, making something for the sake of making something has its own worth and merit. And yeah, I just want to encourage you to make something today and maybe bring that into your practice in some way. You always have the ability of, having some stuff on hand, or like if you're one of those people who kind of knits like in meetings and things like that. I mean, feel free to ask if whoever's in the room with you feels comfortable with you doing that, while you're in session together, and encourage them to bring something, or, you can always print out like coloring pages from, there's a bunch of like free websites that you can grab from for them to color, you know. This idea that we have to do stuff in order to be good at it is kind of damaging, I think. A lot of the kids that I'm seeing right now have this kind of um, almost like it's just this focus on perfectionism, and just if I can't do it perfectly, then I'm not going to do it at all. And that's kind of not how being human works. So if we can also demonstrate failing in the room with folks, or trying something new for the first time and not being good at it, but being okay with that and having that be a normal thing, that can be really helpful for folks. Plus, doing stuff with our hands is good for us, it's good for our brains. All right, moving right along. So I wanted to remind you to keep up with your weekly assignments and activities if possible. I did go ahead and double check through all of the recorded sessions. I had about half of folks not include their skills checklist. So don't forget, if you've already got that, you can either email it to me or drop it. I wrote a comment in the assignment itself if I didn't see the document or the PDF there. Feel free to either email that to me or, reply to it, my comment with it in the comment link there. Um, if you have any questions about that or, confusion, let me know. Feel free to reach out to me. You know how to get a hold of me. Um, but yeah, so it's that the skills checklist, which includes kind of like the beginning, like contextual information. And then, you go through, you watch your video and you kind of rate yourself on the different things and make some comments. And it also includes the transcript of just your words from the recorded session. So just your words, and just kind of the thinking behind, what you were saying in those moments. So, um, don't forget to get that into me as soon as you can. I appreciate it. And if you have any, like I said, questions, comments, concerns, feel free to message me and let me know what's up. We don't have class November 24th through the 30th, so just a reminder for that. Your skills demonstration for evaluating your efforts is due December 8th. And Dr. Perry recently went in and updated that assignment. So there are a few different things that are going on there. Don't worry, it's nothing too crazy, I promise. So you're going to want to make sure to attend or at least review the last optional synchronous Zoom recording, which I will be doing. I'm thinking about even doing it on a Sunday. If y'all have a preference of a time, let me know. Because I know I'm 2 hours ahead of you. So yeah, we'll figure it out. And I'll post that soon so I can get a sense if anybody's going to be able to make it. But definitely check that out. I'll try to keep it short and sweet. Should be more straightforward than the recorded session, which I know is a little complicated. You do have an optional makeup assignment. So if there's any weeks that you missed, you can either go back and, kind of work on those, or you can, do the optional makeup assignment. Uh, and again, yeah, just reach out to me if you have any questions. I know as we're, getting to the end of the semester here and we've got some assignments coming in, um, y'all might have questions about grading or those kinds of things. Please, if you do have any concerns, don't sit on that. Just let me know. Um, and I'd be happy to set up a time. You can drop into my Calendly and, request a time to speak with me or just send me an email or a message um, through the Canvas. Okay. All right, so with the general reminders out of the way, we are going to be talking about resourcing, also known as case management. So we're going to be talking a little bit about what is it, the NASW standards, uh, touching on Maslow's hierarchy of needs. I know the reading this week in particular kind of gives you some alternatives to Maslow's hierarchy, which I think is a good thing because I believe he actually kind of stole the pyramid idea from indigenous folks. So definitely check those resources out. Um, the kind of thinking and best practices behind maintaining a person-centered approach, as well as a strengths-based approach in practice. And then, as usual, my tips and tricks. So resourcing or case management is kind of a cornerstone. Ooh, I can say words of social work. Essentially, and sorry, that's my cat feeder. We have an auto cat feeder, and that's going to go off in about 15 minutes again too. So just so you know, um, getting people connected to other professionals, resources in the area, other programs, things that are going to be most helpful and supportive to them has kind of been throughout social work like a through line. Um, as far as a brief history goes, I mean, you're getting this in your other classes too, but like, we've kind of always stepped in and been the folks to kind of patch the cracks a little bit. Like if there is somebody who's falling through, being able to get them connected to kind of whatever the resources are that they need. I think one of our biggest skills is the ability of researching, Googling. um, Googling is super, like, it's a great skill to have because, especially right now, with being in there trying to search stuff, it's like, if you're already at your maximum and in need of support, folks don't always know how to research this stuff or what resources are active, like especially after COVID, so many programs shut down, but there were also new ones that kind of came up. So having like your go-to resources that you go to can be helpful. The challenges of resourcing also kind of reflected in what I just said, but making sure you're whomever you're referring to, like if it's an agency, if it's another professional, like for example, me being in like a private group practice, I have referred people to like psychiatrists or like a psych NP, nurse practitioner. Um, I've helped people find like an eye doctor or a PCP through their insurance. Um, Challenges right now, referring out resources are very scarce. And so that's going to be something that we're always dealing with as social workers. Um, Challenges include resources, you know, kind of going away and coming back or having their own issues, like talking more about organizations, that kind of thing. Or if individuals have had bad experiences within systems. For example, I've got a couple of folks who have, trauma, like medical trauma, where they've had people not believe them, especially female identifying folks. And transgender folks, and especially women of color, uh, when it comes to like pain and not being believed or having symptoms and not being believed, that, your experience of your own body is valid. One of my challenges is even, making the referral can be hard enough, like finding a provider who is available and accepting new clients and also like their insurance. But, people have been mistreated by systems. And so it's hard to support them sometimes in just, going to a primary care doctor, um, just for their annual physical. So, um, there are lots of unique challenges in, resourcing, but I think part of our way of around that is to engage our clients with kind of wherever they're at, right? But also in a way that gives them the opportunity, like I will bang out like 5 resources. I try to give at least 3 each time, because then it's not like for example, if you're working in a nonprofit, you need to explicitly state that like you're not specifically recommending one over the other. These are in no particular order. Please do your own research. But even being in private practice, I say that every time. Like, here are the big ones that are coming up for me in my research. Do your own research, make the choice that feels best to you. This is kind of how I framed my search, and I encourage you to do the same. Let me know if you have questions or need more support. So hope that makes sense. Let me know if it doesn't. So our NASW standards mean that we have certain ethics and values that we follow. We have to have certain qualifications, uh, and be transparent about our qualifications. We have a certain like set standard of knowledge, and we have like the generalist approach, right? So just because we're not like a super duper expert on, I don't know, bipolar disorder or eating disorders or those kinds of things, doesn't mean we can't be a touch point, um or a part of the individual in front of us journey. But it does mean that we need to know how to do like an intake and the assessments and all the things we've been learning about this semester. Cultural and linguistic competence. This isn't just, different cultures, it's also like generations. Working with kids, like there are words I've heard where it's like, what? What are we talking about? Everybody's crashing out right now. And I feel so old because I'm like, oh yeah, crash out. Crash out means like we're freaking out, right? Or like, so, um, just when we don't know what's up, either ask or research it, right? Like figure out what folks are talking about and understanding the context, right? That person and environment is important. We need to know how to do a basic assessment, you know, um, service planning, implementation, and monitoring. So, if we do a referral for somebody, making sure that there is follow through, and if they need anything from us, as far as like if a release of information is required, sending that over, checking in with the client to make sure they've gone to that individual and received the services they need. And if there's any monitoring, doing that over time. Um, Advocacy and leadership is kind of part of what we do. Um, Not everybody wants to go into specifically like a leadership role or an advocacy role, but we always have those skills and that possibility and potential to kind of step into that if it's needed. I hope that makes sense. Let me know if it doesn't. Interdisciplinary and interorganizational collaboration. So, I mean, goodness, I can't tell you how many times I think I even mentioned this last lecture, or it might be at the end of this one, but knowing your resources is key. United Way, like having somebody call 211, that's groovy, right? Like they can do that and ask for certain kinds of help, or um, if your agency is collaborating, or like you find a new resource where it's like, oh man, I want to have us be a little bit more engaged with the specific company. There's the cat feeder the second time, won't go off again. Um, just being able to kind of facilitate that conversation and maybe a partnership or an ongoing professional relationship with wherever you're referring to, right? Um, Practice evaluation and improvement, that's like for ourselves, that's internally within an organization. Most of the time we won't be like building the evaluation, it'll probably be like built in um, if we're working for an organization. But like if you're planning on going into private practice, you will need to figure out a way to evaluate your practice and improve, results, outcomes, service, whatever ends up coming up in the evaluation as needing improvement. Record keeping, we've talked about that. And just, ways of doing it ethically and workload sustainability. That was actually going to be the next thing I was going to say just in my sentence, but balancing working with individuals and being present with those folks, and then also the number of records and the amount of details or lack thereof we're supposed to keep in our notes. Um, and then we do have that expectation of professional development and competence. That's part of the reason why I picked social work as where I was like the path I was going to go down for credentialing, was because we are required to constantly, engage in professional development and continued learning. Um, that way we can't become stagnant. Um, so Maslow's hierarchy of needs, this is from this image in particular just had all the words I wanted in the way I wanted it. So it's from a blog called Heartmanity. I think it's about humanity, but Heartmanity. Don't ask me. Um, y'all have probably heard about this. I learned this in like Psych 101 when I was in my undergrad, right? I was a psych minor. Um, and essentially, we've got our basic needs at the bottom of the pyramid. Whew. That is like the framework that we can build from, right? Like you need to have a good solid foundation before you can get to the intricacies, right? So we need our physiological needs. So as animals, right, alive on this planet, we need air to breathe, we need food, we need water, shelter, clothing, rest, like we need to sleep. Um, we need to, yeah, be able to like be warm enough when it's cold outside and cool enough when it's hot outside, those kinds of things. Um, the next step up is safety and security, our health. our employment, or that that ability to kind of sustain an income in capitalism right now. Property, having a home to come back to that is safe, um, and that is also like, not being overrun by, I don't know, like ants or things, right? um, our family and kind of social acceptance. So just like our very kind of like more inner, um, there's like that nucleus of relationships, right? So like our very inner circle, um, that safety and security, those make up our basic needs. Um, Once our basic physical needs are met, we move on to our psychological needs. So that's the middle of our pyramid. Love and belonging, like friendship, family, intimate relationships, connections. This can be our faith communities and practices. This can be, art, or whatever community that we engage with, or that feels like it gives us meaning. Um, there's like a loneliness epidemic right now. It seems like it kind of started in COVID, especially with older adults, but folks are pretty isolated overall. And even if I've had clients tell me, like, even when they're in a room full of people, they feel very alone and they feel very detached from what's happening. And I think that's especially with the internet and social media, all of that, it's becoming more and more like people feel alone together as opposed to together, right? Um, Self-esteem. So confidence, feeling like we've achieved things or that we're working towards a goal, and respect that can be among our family, that can be among chosen family, friends, our work. Um, it's important that for us to thrive, we feel that we're supported, that we have a support network, and that we can fail and be held in that, um, and held accountable. So, not just getting away with stuff, right? Um, but to be called in, like when we cross a line or a boundary, and know that, like, people have our backs at the end of the day, and vice versa, those meet our psychological needs. So once our basic physiological needs, and safety, as well as our psychological needs, are met, then we can, work towards self-fulfillment needs. So that's our self-actualization. This is morality, creativity, flow, compassion, experiences, like purpose, meaning, and coherence. So um, whoever's kind of in this, the tip of the triangle, is experiencing purpose, meaning, and coherence in their life. So, like, for example, I've got one client who is in this kind of self-actualization stage, but is like an empty nester. Um, and she's really struggling with, she's been the stay-at-home mom, the caregiver, to her kids and then her grandkids even. And now everybody's kind of okay and grown up. And she's like, I don't even know who I am or what I want. So we're working on those pieces of like building meaning and purpose in the day to day, now that she's not, like, her primary role is no longer being a caregiver. Definitely check out, like I said, the resources that kind of reframe this hierarchy. Gosh, I think it's even like a pop culture thing. A lot of people know about Maslow's hierarchy, even if they didn't study psychology or sociology or social work. So it's kind of weird how people morph these things, and yeah, just it's interesting to me, this being kind of co-opted from indigenous folks. Yeah, there's like a, yeah, look at your resource. Um, so some key ways of maintaining a person-centered approach. Um, this is very relationship based, right? I see the person in front of me. Um, I'm I'm very much, when I'm with somebody, even if they're saying something that I find personally offensive, or um, that is triggering to me in some way, I'm very much trying to be that voice in their head that's non-judgmental, but also trying to be that little like Jiminy Cricket, like, okay, so you feel these things, what does that mean to you? Or like what does that mean for the next step? That kind of thing, right? If it's relationship based, that means I'm showing up as a human to another human and I'm showing my imperfectness and being okay with that, like modeling it essentially too. Um, we all mess up. We all uh say things and do things sometimes that are a little weird. If you just name it and like build that therapeutic relationship, that's very person centered. It's culturally responsive, right? So, um, and again, too, like we're talking different cultures, meaning, yes, of course, different places where people have been born and grown up, but also, like, I mean, if you're talking about different, uh, like levels of income and experience, or even like I've got a gentleman who is a new client of mine who is very much like drove truck and also works on heavy machinery now. And so, the cultural differences and responsiveness is just being open to like being taught or educating ourselves on other people's experiences, being open to knowing that we're not the experts in other people's experiences that they are. And we can always ask questions and giving the client an opportunity to teach us um, is great. I would also say we can teach ourselves, right? Like, I'm not going to ask somebody to teach me about, I don't know, being, assigned male at birth and, transitioning to be trans female. Like, that's not something I'm going to ask them to do. That's something I would educate myself on. But like, if it's like a work thing or if it's, specific to a family like history or like how does your specific family unit like deal with you know uh the young women versus the young men in your family, right? That kind of thing. um Person-centered approach is still anti-oppressive, right? um so when we've established that relationship, that means that we hold people accountable. um it's not about shaming individuals, but about being curious and asking questions, right? Um, Anti-oppressive means that we're not accepting behaviors or actions that put us down, put others down. Um, and also that, the clients say to themselves that put them down, you know. Um, we lead with research informed uh modalities, techniques. We're not just kind of whipping whipping stuff up uh, as we go. Um, all of the things that we're talking about in this class are very research informed. A person centered approach is research informed. Um, we're also trauma informed. So again, that trauma informed care perspective of we've all experienced trauma. And just leading from that perspective, assuming best intent, that's a very person-centered approach perspective. Knowing and understanding and respecting others' boundaries, but also being very clear and modeling our own. I'm still learning about my boundaries for real, like in my job right now. I am still figuring out what my schedule looks like. I'm still figuring out how to communicate that to my clients. Um, the boundaries between like trying to do some research and getting folks resources versus, being able to be present with them in a room. Um, and also psychoeducation. So teaching people about what's going on with their with what they're experiencing, like that window of tolerance or the fight, flight, freeze, fawn, collapse, like being able to give them the education piece because like we've been privileged and lucky enough to get this education, right? So being able to share that so that people can make decisions based on information, right? That research based information that we're giving them. So, like, when I worked in the dialysis center, if we had a few different options for somebody, I would take the time to try to walk them through the different options. So the different types of treatment and what that would entail. We would have folks referred to our clinic who hadn't been talked through what dialysis is and what, you know, reduced or limited kidney function is, you know, and what that means and how it impacts your health in the short term and long term. Because we would have folks just skip out on treatments, and it's like, it's accumulative, you know? And it's like people weren't having those more in-depth conversations with folks. So really taking the time to um, educate folks on options, I think is a really good way to have a person-centered approach as well, because then people can make informed choices. And that's another big thing about what we do as social workers. We want make people to make informed choices. Uh, Strengths-based approach. Okay. So, before you begin, ask yourself, are you expecting strengths as well as challenges? So, part of our, psychosocial, spiritual, cultural assessment is making sure we include those strengths and trying to pepper them throughout. So it's not like, oh yeah, here's the strengths section at the end. We need to button this up with some positives. But no, like really shifting your perspective into like not just what's the problem, but also like what's going well, what have you been doing already? Because most people have been coping the best way they can, and you will be amazed at the things people have done to just be able to get to sitting in front of you, you know? Um, like people have come up with insanely creative solutions and coping mechanisms um, to just get to the point of where they're at. um, so just know that there are always strengths, not just the challenges and not just the stuff we want to work on or need to work on, um, but also like the things that are already going well and the things that the client's already done to protect themselves or to, um, to make it this far. Make sure the meeting can be conducted in the person's preferred language. So, um, if you need to use an interpreter, uh, do whatever you can to make any awkwardness on your end, like not the interpreter, not the individual. I know one of the things I really disliked at my when I was at the dialysis center was that one of the problems in the care plan would be if the person did not speak English. And I'm like, that's our problem. That's not a client's problem. That's not their problem. That's us. We're bad. Like we're the people with the problem because we don't speak their language. That's not a them problem. Why are we putting it in their treatment plan as a them problem? So you know, if you have the opportunity of taking, like a lot of our agencies will offer like a language translation service, and so do your best to familiarize yourself with that service and how to best utilize it. There are like trainings you can take and just ways that you can like improve those types of interactions if there has to be like an interpreter in the room. And yeah, that means it takes a bit longer, but that's okay because as long as you've got like a competent like interpreter in the room, it can be very smooth, and folks tend to be familiar with having an interpreter in the room because of that. Sometimes having a family member interpret is actually kind of the best option. I know a lot of places will say we need to have a medical interpreter or what have you. And yeah, sometimes you do. Talk to, your agency, uh, double check with the individual um, to see whether or not they're comfortable with whomever's interpreting for them, like if it is a family member. Make sure that there's no maybe conflict of interest. I know having like adult children or even children interpret for parents or grandparents can be tricky. So definitely just do what you think is right, but also be aware of, am I just making this choice because it's easy? Or is this because it's giving the client their best opportunity to, you know, to get to their goals, gather information conversationally, right? So try to like familiarize yourself as much as you can with your workflow, like with your assessment flow. Um, there are always weird questions, right? Like that feel like they come out of nowhere, but just do your best to make it seem more conversational. And honestly, if it's weird, you can just say it's weird. Like, hey, I know this question is kind of coming out of nowhere, but bear with me. Um, and I always like to blame the insurance companies. So like, hey, insurance likes to make sure that we're aware, XYZ. Um, because the way that they do workflows in like EMRs or EHRs, so the electronic medical record system or the uh, electronic health record, isn't always like the flow of a conversation. So just as you get familiar with your resources and your agency and like what that workflow is, it's easier to make it more conversational. But again, I mean, I make jokes about myself all the time when I'm engaging with folks, even though I've been doing this for a bit now and I've done customer service for even longer. Um, make it like you can call it out if it feels weird and acknowledge the weirdness of the situation without making it about the client, but just like, hey, I get that this is like kind of awkward, but can I ask about your sexual history? Or you know what I'm saying? Like, um, given primacy to the person's perspectives by eliciting their voice, hearing their stories, and taking their ideas seriously. So I'm not telling them what the problem is, right? I'm asking them, like, tell me how we got to this moment. What's most important to you? Um, when you're writing notes, you can even quote people, just put quotation marks and make sure that in your note you're making it clear who's saying what, especially if there's more than the client in the room, right? Um, you definitely want to highlight their voice and just make sure that that is peppered throughout the language you're using. Like, so the language you're using in session with them is reflective of the language they're using. um, and that can be incorporated in the treatment plan, in the goals, in the assessment itself. um, and I mean, really, you can get so much background information if you ask an open-ended question that allows them to tell their story. um, Even just like, how did we get to this moment? What are the highlights? Can you kind of talk me through how we got here, or what brought you to therapy? Discovering what a person wants, like their aspirations and goals and dreams. I mean, it kind of maybe sounds a little Pollyanna-ish, but like figuring out the motivation behind the change is so integral because we can always bring it back to that, right? Like, I'm asking you about this or I'm giving you this homework because it relates to the goal you told me about, like wanting to be more social. So yeah, I'm going to ask you to try to look at some stuff in your area that looks like it might be fun. I'm not going to tell you to go do anything just yet, but then you'll see that there are people out there doing cool stuff that you're into, Um, elicit, point out, and record a person's talents, skills, and accomplishments in multiple life domains. Um, a lot of notes for me, like especially at the intake and as we go through our sessions together, is what's going well, um, what they've already accomplished, and just especially if a person can get to a point of articulating what they're good at or what they feel they're good at, what they like about themselves. We can also always go back to those pieces too. Like, hey, but your freckles though, right? Even if it's like funny, like even if it's like a joke that we always come back to this thing, if that's the rock, if that's the thing that the touch point that keeps them grounded in the work, that's awesome, Um, identify successful coping and problem solving strategies that the person has used in the past whenever possible. So again, if we're collecting a history, we want to see like, what have you done in the past when this has happened before? Like, oh yeah, you mentioned you've had depression your whole life or anxiety your whole life. Like, have you seen a therapist before? Have you had any treatment for that? Have you ever been hospitalized? Have you had medications or, tried any techniques before? What worked? What didn't? You know? What do you do now when you feel like you're about to have a panic attack? Have the person identify what unmet needs are most important to address first. So, prioritizing their list of goals is really important. And I just, usually as we're kind of wrapping up the session, I usually go like, okay, end of therapy. We're shaking hands for the last time, or I'm waving to you goodbye. Like, what are the things that we've accomplished? Like, what are the three main things that have changed? Um, and sometimes it isn't even an unmet need. It's something that they want to maintain or build upon that they're already doing. And again, we're avoiding a blaming, diagnosing, or labeling individuals. And we try to make them a partner and a collaborator in their own care. So, even if folks are in a cycle of substance misuse, it's never about blaming, shaming, or even like diagnosing really or labeling folks as somebody who's an addict or those kinds of things and if you hear people utilizing that language for themselves, I would strongly encourage you to have one of their first homework assignments or have one of the first exercises be like maybe not necessarily immediately challenging that thought or that thought process, that internal narrative, but really becoming aware, like starting to notice what they're telling themselves without judgment, you know? So we're not mad at ourselves, we're not whatever, like, oh yeah, I'm overthinking again. I'm naming that and I'm not judging it. Cool. Okay. And then, you know, that creating that space, right? Cool. So my tips. So resourcing is very different than like fixing somebody or that thing of like offering insights, right? Um Resourcing is like I noticed, okay, so you have a lot of financial concerns right now and it's really bringing you a lot of anxiety. Do you feel comfortable kind of talking to me a little bit about what's going on so I can maybe give you some specific resources that might be helpful? And if it's a medical bill, right? So many folks have medical bills. They can bring their bill in with them to the session and we can sit and record, like call in to the billing department and say, what options do you have for somebody who's financially struggling? There are often, applications people can fill out for for grants for helping that, or, just the hospital themselves usually have a pool of funds for folks who can't afford care. Um, Explaining options and choices. So again, really going into detail about, you know, uh, if you do nothing, here is my understanding of what would happen. Or can you tell me if you stayed the course right now, what would happen? Like talking it through with them. And then, okay, if we made this change, then what would happen? Or like if we made this change, then my understanding is this thing would change, or that this like I'm trying to think of the specific example. Like with medical care specifically, right? It's just making sure, like if you're in, for example, if you're in an interdisciplinary team meeting with a client or their family members, asking them like, do you understand what the doctor just said? Because that was a lot of like medical terms that I don't quite understand myself, so I just want to make sure, can you say that back to me? Like, I just want to make sure you understand, and that if there's a different way we can explain it, that it makes sense. Because people also assume doctors know what they're talking about, or they just kind of smile and nod because they don't want to appear dumb. But I'm like, I will be the first person to be like, wait, 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 know what? That didn't make sense to me. Did that make sense to you? Because like you know, um, don't assume what the client's priorities are. Always ask them, and ask them what they're open to as well. Because like if you're hearing, like if somebody brings up their finances like 5 times in the first session, but they're saying their primary thing is sleep, be like, you can always ask them like, hey, I know you mentioned your finances a bunch today too, or a handful of times, or however you would phrase that. is that a goal that you would like to include as well, or is that something you'd be open to me providing some resources for or for us talking about? Um, oh yeah. Okay, so that wasn't a previous lecture, that was this. So don't reinvent the wheel. It's okay to use resources that already exist. You can also like call your local, usually resources like United Way. Just know the zip code where the person lives. Or you can even just call United Way yourself and be like, "Hey, I'm a new practitioner. I'm a new social worker, and my internship or my job has started in this zip code, and I'm just trying to get a sense of like what are the biggest things y'all get calls about, and what resources do you refer out for that?" Most people are like totally happy to give you 5, 10 minutes of their time, because they know that you're a contact point as well for resources. So, um, just get to know your area, get familiar about what's already available. A lot of like city or county programs exist, so um, Google it. Yeah. And I always say to my clients too, like, this was kind of a high level overview. Do your research, like, make sure you check into these things, like, and so that you have the ability of kind of empowering them to do the work and not just like, I'm telling you to follow up with this resource, right? Um, really empowering them to take ownership of doing the deep dive, making sure the agency is still active, making sure they're still accepting applications, making sure that the provider is still accepting a new patient, that kind of thing. Um, Whew, I feel like I kind of rambled a lot today. I apologize if that's the case. Um, Thank you all so much for your time. I hope y'all are doing okay. It feels weird out there right now. I don't know if y'all are feeling this too, but it does feel kind of like things are a bit wonky and we just need to be kind to ourselves and each other as much as possible. Know that we're not alone in experiencing the weirdness and the stress. Like this time of year always feels a bit weird, I think, with the time change and with, the holidays upcoming. Um, there's just a lot to get done. And so definitely be kind to yourself. Wear your extra warm special hoodie if you have one. Make things with your hands. Um, do stuff that you are bad at on purpose just because it like lets you know that the world's not going to end. um and yeah, I'll let y'all know when week 14's lecture is recorded and up. But yeah, uh I will see you next time. You know where to find me if you need anything, okay?